Hi, my name is Shin, Master of Ki Energy Therapy. I have a special ability to withdraw spiritual energy called Ki from universe freely. I utilize this energy and quickly reduce pain and improve condition of almost any kind of diseases and sickness and injuries. I don't utilize any medicine, shots or needles, just Ki energy. So my therapy is very, very safe. No side effects, yet remarkably effective. Today I'm going to talk about one of incurable diseases called diabetes. It is so-called incurable disease, but yet if you know how to take care of it, it is not incurable, it is quite curable. I'm going to present how to do it in this video. Before getting into the detail, I just want to clarify that I am not a medical doctor. I am not a scientist. I'm an expert on Ki energy therapy. So whatever you hear from me in this video may be quite different from what you learn from school or what you hear from doctors or pharmaceutical companies. There are 4 segments in this video. The first segment is high blood sugar does not mean that you have diabetes. Second segment is the most dangerous side effects doctors do not let you know. Third one is the true cause of diabetes. And the fourth section is how to improve and cure diabetes correctly. High blood sugar does not mean you have diabetes. The reason why I can say that because if you eating more than your body can handle that, if you keep eating more than your body needs, it is common sense that you're going to increase blood sugar level. At the beginning, your body is handling your too much sugar intake by pushing through your urine. But if you keep abusing your body by eating too much or drinking too much, too sugary, too starches, then gradually your blood sugar level going up. But if you do exercise and cutting down intake, you can easily control your blood sugar level. But if you don't do it, and if you're getting older, or getting overweight, your margin of error becomes smaller and smaller, and one day your body no longer be able to handle sugar level in your bloodstream, then you are developing diabetic conditions. Then what happens? You go see a doctor, and doctor going to prescribe medications or insulin intake. Once you start taking medications or insulin regularly, you start realizing that your blood sugar level is controlled and become lower. So you think you are okay. But do you really think you are okay? And do you really believe that medications or insulin intake continuously solve your diabetic conditions? I want you to stop taking it. If you take about 6 months or 1 year, I want you to stop taking it. Then what happens if your sugar level go back the same level as before? Insulin or medication you've been taking is not effective at all. What those medications be doing is to masking your problem, just masking the symptom of the problem. So how long you may have to take it? Entire your life? Then what happened? Our body, our brain is so smart, yet so much capability to adjust to new environment. One of the best function of our brain is try to fix the problem or rectify the problem. So if you have too much sugar going in, eating too much, your brain tells you something's wrong. But if you ignore it by adding medications or insulin continues to the body, our brain is also capable of adjusting to a new environment so that brain giving up. Once brain giving up, you are no longer be able to fix your problem naturally. That's the most dangerous side effects of taking medications continuously. Yes, once in a while we need medications outside help. It's got to be temporary, not continuously 1 or 2 or 3 or 4 or 5 years or entire life. If you keep taking those medications and insulins, what's the end result going to be? Can you think about that? I have 3 clients who come and see me with pancreatic cancers. All those 3 are all ex-diabetic, taking insulin and medications 10 or 15 years. It's common sense. If you take medications and brain is brainwashed as if everything's okay, then what happened to your organs? Organs stop functioning the way it's supposed to be. As a result, after 10 or 15 years, after you're getting older, it is quite common that you become cancerous. The risk of getting a cancer of that organ is much, much higher by taking insulin or medication to mask the problem of diabetic conditions. Then your next question is, how can we improve and or cure diabetes without taking medications? Without knowing what the cause of disease is, we just cannot fix the problem. And we tend to believe the cause of diabetes is excessive eating, excessive drinking continuously, as well as taking medications continuously. Yes, it is true, but it's only half of it. Rest of the half is not coming from there, but coming from within ourselves. Somehow, if our pancreas cannot function well, or liver, or gallbladder, or fourth one, which everybody ignores, that is the function of duodenum. That's the section right after the stomach and between stomach and small intestine. Duodenum is the area pancreatic duct is attached to. If duodenum becomes tighter, duodenum cannot absorb insulin from pancreas. As a result, blood sugar level go up. Even though if you're eating normally, blood sugar level go up because insulin is not appropriately absorbed from that area. So fixing and improving the condition of 4 of those is a lot to do with the diabetic condition. Then how we are going to do it is the next question. I have a special ability to fix and improve those conditions because those conditions come from 2 areas. Tightness of organs. Every organ is a muscles, different type of muscles, but muscles. Muscle, if it's been abused, become tighter, then function of muscle diminishes. At the same time, nerve attachment to that organ, if it's not appropriate in length, that organ cannot function. And it's almost located the same area on your back between T5 to 8. If that area, the back or spine, is deviated one way or another, 1 or 2 of those organs cannot function normally. And if you do not fix it for a long time, it tends to be malfunction as a result, even though if you're not eating too much or excessive drinking or eating, but you still develop diabetic condition. So fixing those organs tightness, as well as fixing the length of nerve attachment to those organs is a key factor, and those are in fact major cause of diabetic conditions. That's what I do. By doing it, and if you are taking care of yourself by eating normal amount of food or your body needs and reduce weight, diabetic condition is quite curable. In fact, we can cure diabetes because we are attacking and rectifying the major cause of the problem. Let's go back again. Make sure you don't eat and drink too much. Make sure you do physical exercise and get sweat. Make sure you lose weight if you're overweight. Then if you fix, in addition to those, if we try to fix those nerve attachment as well as tightness of those organs, we're going to be able to overcome diabetes naturally. That's, I can help you to do it.